Hi, Dr. Bickel. Thanks so much for walking with us today for our March Walk with a Doc. With spring right around the corner, this month we're going to focus on seasonal asthma and how weather and season changes can trigger our child's asthma. Are you ready to get started?
Absolutely. Thank you for having me.
Let's get started. The first question our parents may be wondering is, what is asthma?
So that's a great question. Asthma is a chronic lung disease that can affect children of any age or adults or teenagers. And it consists of recurrent coughing and wheezing and shortness of breath. The airways get inflamed and swollen. And so, but with proper medication and treatment, it can be well controlled.
What are signs and symptoms that my child may have if they have asthma?
Sure. Yeah. So children with asthma can exhibit a wide variety of different symptoms. So common things are coughing at night or getting short of breath with activity, maybe wheezing or having chest tightness at various points in time. And there's lots of different things that can bring these symptoms on. Sometimes they're mild, but they can be, they can be severe and cause significant difficulty with breathing.
Now that we know what asthma is and how asthma can affect our children, can the weather and season changes affect our child's asthma?
So that's another great question. And we have a lot of families who note that their children's asthma seems to vary with the seasons. And there can be a lot of different reasons. The temperature fluctuations can irritate airways, especially real cold air, might make it more difficult to breathe. But then allergies as well that come up seasonally in the spring and the fall, pollens and different things like that can trigger asthma and potentially make it worse.
Is there anything we can do to help avoid triggers?
So I think it's a thorough evaluation to see what your triggers might be, and then figuring out ways to minimize avoidance or to get on a treatment plan that might help to control your symptoms. Can be very important in getting control of asthma.
How can my child manage their asthma on their own?
So that's an important part of asthma for children. Children can be taught to recognize their symptoms and how to use their medications. We have many school-age children and teenagers who carry their own inhalers, and that's an important part of managing their disease.
Thank you, Dr. Bickel. Now, our parents may be wondering, what are signs that my child should look for that their asthma may need emergent medical attention?
So this can be very scary, but children who or teenagers who have really difficulty getting a breath in or out, who have chest tightness, who maybe the parent might notice that they're having labored breathing where they're retracting or tugging at their chest, children who are unable to talk in more than single words, and maybe even developing color change like blueness around the lips or the face or the hands. These are some of the signs that an asthma attack may be severe and that the child needs to go to the emergency room or call 911.
Our last question, what if I think my child may have asthma?
So if you suspect asthma, the best place to start is with your pediatrician. Most pediatricians can take a thorough history and do different tests to evaluate for asthma. If you have symptoms that are persisting, sometimes an asthma specialist, either a pulmonologist or an allergist, can do more further evaluations and workup, and together we can get a treatment plan in place to help keep your symptoms under control.
Thank you so much, Dr. Bickel, for taking the time and walking with us this month. Our parents and caregivers really appreciate you. Our viewers can click the link in the post for additional information about childhood asthma.
Thank you so much for